The pill. At some point in time, most of us have learned that the pill, what often looks like a compact full of daily candies, is one form of pregnancy prevention. What some people may not consider, however, is how new oral contraceptives are and what their side effects may be. The Food and Drug Administration approved the first form of OCP, Enovid, in 1960. Before OCP was approved for use in family planning and voluntary motherhood, oral doses of estrogen were used for therapeutic purposes. It was only in 1978 that the FDA required information sheets with potential risks to be included with pill packages. Is the pill just for preventing pregnancy? No, the pill actually serves many other purposes than just its role as a popular contraceptive. In fact, around 15% of oral contraceptive pill prescriptions are given to treat and prevent certain medical conditions. Some of the most common conditions that the pill is prescribed for include endometriosis treatment, ovarian cancer prevention, and severe cases of acne. How does the pill do all of this? To understand, let's take a closer look at the condition endometriosis and how it is related to the reproductive hormones estrogen and progesterone. Basically, this is a condition in which the endometrium, inner lining of the uterus, grows outside the uterus. Sometimes this growth is on the ovaries, lining of the pelvis, or on the fallopian tubes. This type of tissue thickens just as the endometrium does during ovulation. Also like the endometrium of the uterus, endometriotic tissue goes through a type of menstruation process where it breaks down and bleeds if the ovulated egg is not fertilized. However, because this endometriotic tissue is not in the correct place for menstruation, it cannot leave the body and instead builds up in the form of cysts. This condition can be extremely painful and may even lead to infertility. The pill steps in by prolonging the deciddualization of the endometriotic tissue, basically keeping it thick and not allowing it to shed and form cysts. The progesterone in the pill suppresses the trigger for the tissue to shed. This process slows the growth of the disease by not allowing more endometrium-like tissue to grow in the parts of the reproductive system where it does not belong.
So how does the pill work? Well, let's break it down. The birth control pill itself is under the category of a synthetic steroid hormone, which mainly consists of either a single hormone, progestin, or two hormones, progestin and estrogen. The pill works by inhibiting the release of two hormones, the follicle-stimulating hormone, FSH, and the luteinizing hormone, LH, from the pituitary gland. FSH and LH are meant to trigger the release of estrogen from the ovaries, causing the stimulation of ovulation or the release of a mature egg from the ovaries. Meaning that when these two hormones are suppressed, the chances of ovulation and thus fertilization of the egg by male sperm is significantly reduced. However, it is important to note that the production of estrogen is only limited and not completely stopped, because without estrogen, a person on OCP could be at risk of osteoporosis later in life. In addition, progestin-only birth control pills cause a thickening of the mucus in the cervix, which makes it very difficult for the sperm to reach the egg during ovulation. OCP, however, is not guaranteed to be 100% effective in ensuring a user does not get pregnant. In fact, it is about 93% effective with proper usage, and there is still a possibility of a user getting pregnant while on the pill. What short-term and long-term effects are caused by the birth control pill? Well, to really understand these effects, we must keep in mind the fact that the pill can have different effects depending on the medical history of the individual.
For example, patients on OCPs may have a greater risk of a first ever stroke, especially if the patient smokes or has a history of hypertension. It is also important to note that the mechanisms behind this increased risk of stroke are not well studied. It is, however, theorized that different variations of the hormones in the OCPs may affect patients with a history of VTE differently. This is why medical history is important in considering which medications work for each individual patient.
On top of that, many of these side effects are either understudied or only at the early stages, since OCP has not been around for very long. With this in mind, let's explore the potential side effects of OCP. There are many studies trying to find a link between taking oral contraceptive pills and long-term depression. However, thankfully, most have concluded that oral contraceptive pills do not increase the risk of depressive disorders. Another question has been raised about how taking oral contraceptives throughout puberty and adolescence, which is a critical period of development, can affect someone behaviorally and psychologically. So, let's dive into this topic and explore what this may mean based on some emerging evidence from 2020. This newfound evidence now suggests that using OCPs throughout adulthood has caused blunted stress reactivity in individuals on the pill. It has even been thought to influence the structure of the individual's brain. For example, specific brain regions may have an increase and decrease in gray matter volume, and a decrease in white matter integrity and cortical thickness. There is even evidence that users show a difference in brain function at rest and during tasks related to memory, reward, and emotion. In the end, the best thing you can do is to stay educated about women's health and safety concerning birth control methods. Even if you feel like this subject does not directly apply to you, it does. Birth control concerns everybody. Knowledge is power. More information and education on the topic can lead to healthier and happier people. So many individuals rely on OCP for many different reasons, and they need adequate representation in the media and in policies concerning the production and regulation of birth control.